Hello, everyone, and welcome to the Spirit of EQ podcast. This is Eric Pennington with you today, and we have a very special guest. And I want to say special because I've known this gentleman for a minute, and he's always been insightful for me personally. And selfishly, as a doctor, I've been able to lean on him when I've had experiences that didn't quite make sense. So there's the definition of special. But Mickey Liebowitz, MD, is joining us on the Spirit of EQ podcast. Welcome, Mickey. How are you?
I'm well. Thank you, Eric. What a treat to be with you. Always is a treat to be with you, Eric.
Hey, even when we don't record, it's that way for me, Mickey. You know that. So the great part about this is if those of you who have followed the Spirit of EQ podcast and Spirit of EQ in general, we did a EQ Conversations video cast. This must have been a couple of years ago. And then that was probably in the midst of COVID. And then as things have turned, I've always wanted to get you back on because obviously, I mean, healthcare has been sort of front and center for the last 3.5 years, right? So I'm going to dig right in and kind of start with this question for you, Mickey. When you think about the healthcare system as it's constituted, and I'm going to kind of lean heavily on the people side of it, the human interaction. Whether that's between a doctor and a patient or with a doctor and a nurse or anything of that nature. What do you think are maybe some of the fundamental problems as you look at the healthcare system? And I would say, and I'm always bad at this, Mickey's bio will be in our show notes, but Mickey, you've got a long history of being a practitioner, being a teacher. I mean, you've done a lot of things. So as you look at the healthcare landscape, what do you think are some of the fundamental problems?
Well, I'll speak from the side of the provider or the physician or the clinician,
Mm-hmm.
and there are, there are many things that make the job very challenging. And if I could preface my remarks by saying that, it takes a long time, especially from a physician standpoint, to get through all the training and actually get out there and practice as a physician. I mean, for me personally, it took several years, 5 years of undergrad. It took 4 years of medical school, an internship, a residency, a chief residency, and a fellowship. So it was 15 years before I finally got my quote unquote first real job. And
Wow.
somebody might imagine that along the way, that when you finally get out and practice, it'd be a really enjoyable kumbaya time. And because you put the time, effort, energy to achieve a particular expertise. And as it turns out, it's not always kumbaya. There's a lot of friction within the system. In
Mm-hmm.
fact, I wrote about this in a book that I authored back in 2009 when I left my private practice. The name of the book is called "Losing My Patients and Why I Left the Medical Game," because in a way it did become a game. So I highlighted many of the challenges that physicians were facing back then. And unfortunately, many of the issues that were present back then are present now and even worse. In fact, the title of the book, Losing My Patients, came from when I was doing research on the book, and I was looking back at issues in 2007, and then looking back at what was going on in 1997 and 1987, I said to myself, man, I'm losing my patience with this stuff. And that's the title of the book.
Yeah.
In the book, what I highlighted is the challenges, not really seeing patients, because seeing patients is what we were all trained to do. But really, the challenges in healthcare from a physician standpoint came from all the outside influences on the physician to deliver the care that they would like to deliver and the patients would like to receive. And you might ask, what am I talking about specifically? And what I highlighted in the book
Yeah.
was the the bureaucracy, all the regulations, all the pharmaceutical companies, although they do wonderful things in producing fabulous medications, they're too expensive for many of the patients to afford. So you might make a great diagnosis, have a treatment plan, prescribe a medication, and before you know it, the patient comes back and you ask, did you take the medicine? They go, no, I couldn't afford it. and all that good work goes down to nothing. So regulations, the pharmaceutical, the insurance companies have really influenced the type of care that we could provide by rejecting tests that we might order or medications we might order. They put an enormous pebble in our shoes and make a hard day even harder.
Yeah.
There's also the risk of malpractice. Happily, it hardly ever happens. For me, it only happened once. Happily, it's the worst day of my life when that happened, and I still find that to be a huge scar, even though it's over 25 years ago. But that's always in the back of your mind. Gosh, if something doesn't work out, am I going to get sued? And what could be more abhorrent to somebody who's dedicated their life to making people's lives better than the threat of somebody suing you because you might have done something wrong? And listen, let's face it, we're all human, and we're all trying to do the best we can for our fellow humans, and not everything works out the way you want it to. So it's a little bit of a long-winded answer, but I think the biggest challenge from a physician standpoint is the outside influences that can impact how we want to deliver care to the patients that are trusting us to receive that care.
Yeah. Oh, that's great, Mickey. That's great insights. And I'm going to touch a little bit about the malpractice thing, because I think it goes to something, and I know we're going to talk a little bit about EQ here in a minute, but this idea of intrinsic motivation. I've always approached my health, even when I didn't do it very well, that it's my responsibility. I looked at my physicians, and I still do, as advisors, maybe consultants, if you want to call them that, where I come in, they diagnose, they give me insight, and then they give me options. I might decide to take option 2 and not take option 1 and 3. And I've even said to my wife, I said, I would be more than happy with my physicians to sign a document that says I hold responsibility in my lap. Now, I do understand that there could be something where it is negligence. It could be something where the doctor should have known, should have crossed the T's and dotted the I's. I get all that. But I think in most situations, I see far too many people that are willing to cede their autonomy or management of their health to a physician. And I say that in light of, kind of this idea that somehow, Mickey, if I come to you as a physician, just tell me what I need to do. Just tell me how much, tell me when, and I'll rely on you to just tell me how to manage my health. And I'd never have thought that. So it comes to that idea about intrinsic motivation. And I get it. It's not always as clear cut as it is maybe for me. Some people maybe are not in that place, not ready to take that on. But when I think about that, it makes me realize that the importance of emotional intelligence in that regard, right? In this intrinsic motivation, that, wait a minute, I'm not going to rely on external forces to help me or to direct me to make certain decisions for something that I'm responsible for. So that's a long-winded way around to come to asking you, do you think, whether it's a physician or a nurse or an administrator, could they benefit from the work that's found in EQ?
Well, certainly everybody in the whole world could benefit from the emotional intelligence. It would be a much more peaceful, verdant world if people did practice emotional intelligence and the art of doing so. And we could talk a lot about that, but to be specific about EQ and healthcare, to take the sports metaphor again, I look at myself as a coach, and I look at the patients, if you will, as the players. So I could stand on the sideline and yell out instructions, let's say to somebody, as an example, who has diabetes, and I could say, eat less, move more, take your medications, and in the end, you just hope that they will do so. But then the question is, well, how do you help somebody bring to light, if you will, their own intrinsic motivation? And that's where emotional intelligence comes into play, because as a physician, you have choice, and it could be my way or the highway. This is what I say to do, and if you don't do it, then you're out. Or better yet, which was my style, is you could really be a chameleon. And what I mean specifically about that is I have to basically understand who's in front of me and what makes them tick. And
Mm-hmm.
in order for me to better understand what makes them tick, I have to have my own level of self-awareness. What am I feeling with that particular person at that particular time? Then I have to basically understand to be socially aware, what makes them tick, what really motivates them, what are their obstacles, what are their barriers, what are their challenges,
Mm-hmm.
based upon knowing how I think and feel and how they might think and feel. Then I could use self-management, which is my ability to make decisions, knowing that I have choice. I could say one thing, I could say another thing, but what is the exact right thing to say for that particular person to take it to the next level of EQ, which is relationship management? What do I do and say, and how does it impact that particular person? And does it enhance our relationship? And to that end, build trust. Because as one patient said to me not long ago, he said, "Doc, I think you care more about me than I care about me." I think he was right, actually. And
Wow.
and despite some of the obstacles that he has, the fact that I cared so deeply about him, that he trusted me well, that he was willing to follow my instructions. Then
Wow.
the last piece, once I know how I think and feel, and I'm self-aware and social aware, and I've self-managed, I made decisions based upon that, and I've enhanced our relationship by building trust. It comes also down to what do we want and what don't we want, which is self-direction. So I think that there is a lot that could be benefited by the physicians or clinicians' ability for emotional intelligence. It just gives great opportunity to build that relationship and that rapport, that trust, which will then, I think, encourage the patient or the person who you're working with to do more for themselves, because sometimes they just don't even want to let you down. The
Yeah.
patient doesn't want to let you down.
So, Mickey, and I have heard this from those in the healthcare realm. I don't have time to do all of that. I can only, I'm required to spend a certain amount of time with each patient, or we've got a caseload of X, Y, and Z. What do you say to those folks?
So let's take a scenario. How long does it really take? Let's take empathy. Somebody just tells you a story.
Mhm.
They're telling you how they fell as an example and they hurt themselves. How long does it say, "Wow, that must hurt like heck. How you doing? How you holding up?" We
Mm.
use one of the great skills or strategies that I use, and it was taught to me through 6 seconds, was this concept of the vetting. If somebody tells you a story, validate, V, E, explore, and T, transform. And it doesn't take very long. In fact, it doesn't take any longer to let somebody know that you feel with them, and then
Mm.
explore how they're feeling, and then help transform them. Boy, you fell. That hurts like heck. How you holding up? And then
Yeah.
T, and what can we do next to help you get better?
Yeah. Wow. So you've made a great argument there. So what do you think is the resistance to it? And don't get me wrong, Mickey, I know that the weight of EQ is not on your shoulders for the healthcare system of the United States. Um, but and maybe I should ask it this way: is do you see the things that we're talking about here starting to permeate inside of the healthcare system, or not?
Well, the issue for we have a saying in medicine that the eyes can't see, the ears can't hear, and the hands cannot feel what the mind does not know.
Mm,
And my concern is that physicians may not really know or fully recognize, and and I'm certainly not talking about everybody, because
right, sure.
it's a diverse population,
Yeah.
But there are many who may not know the value of emotional intelligence and may not be aware of the value of being self and socially aware, of self-managing, relationship management, of self-direction. They may
Yeah.
not know the strategies, and they're just going by their instincts. And instincts could be good sometimes, but the beautiful thing about emotional intelligence, which I talk about at workshops. I have to give a workshop this afternoon to a group of physician assistant students where I'm the medical director.
Mm-hmm.
But to give them a structure and a strategy on how to use emotional intelligence to be able to engage their patients. And the beautiful thing about emotional intelligence is it doesn't like all of a sudden leave you when you walk out of the clinic or the office or the hospital. It's something that's transferable and can be used in your personal life also, and can
Right.
really enhance your relationships with family and friends. So I think that that physicians, and this is another thing, how do you get into medical school, or how do you get promoted or awarded through training? And that is based typically about on your intellect.
Mm-hmm.
And people don't really reward you for your abilities to connect with other people. So it's not really taught. It's like either you have it or you don't, which brings up another beautiful thing about EQ, which is it's a competency. It's something you get better at. It's
Yeah.
learnable. But it comes down to one old riddle. How many psychiatrists does it take to change a light bulb? And the answer is one. Light bulb has to want to change. And, for physicians, who are busy, do they have the capacity to change, or do they even want to change?
Yeah,
Because
because that's interesting when you mentioned that, and I'm thinking about my own experiences. The I have a personality that is, and thanks to the Enneagram, it's helped me understand this about myself. Um, I'm not one that does well with being told what to do. And maybe in my younger years, I had issues with authority. Never went over into crime, but the fastest way to get me to buck up against it would be someone telling me, "You better do this," or you're going to have to do this. Because to me, that's a rallying cry to go, "Well, no, I'm not." Right?
your trigger.
Right. So I've thought about physicians that I've had in my time, where the ones that approached me with this, you need to do this, you need to take this, no questions asked, you just need to do it because I'm telling you, I know. And I just think back and go, if they had been more aware, if they would have been more, they might have said to themselves, that's not going to work with him. It's very clear that is not going to go well. So I need to adjust. Maybe I need to just, you know what? We don't have to immediately do this. I need to spend more time in developing slower because there's a trust gap, whatever it may be. Right. And I just, what you were just saying, it just makes me realize if there's that gap from a patient perspective, if I feel like, no, you're just trying to instruct me to follow rules, I'm going to recoil. And someone could say, but Eric, they're a doctor, they know so much, they've got this. And you know what, they could be a nuclear physicist, they could be Stephen Hawking reincarnated. My personality, it's who I am, right? So here's something I gotta also go from an empathy standpoint for physicians. I know that at least the ones that I've experienced, and even in the time that I've known you, Mickey, there's a tremendous level of care, a desire for the patient to have a good outcome, right? I think at times they've got to be feeling some levels of burnout on two fronts. And let me unwrap that a bit. You have patients that are not doing what they need to do to manage their own health, lifestyle, and such. And you got that system that you just talked about, both coming at them. I got to believe at some levels, there's some of them are saying, why in the world am I still doing this? Why in the world should I continue to bang my head against the wall when it doesn't seem like it's moving in a positive direction? So can we talk a little bit about burnout? What do you think that's, how's that playing a role in this dynamic?
Well, since you bring it up, um, the studies have been coming out over the last now many years, and has been intensified through COVID. Is that the
Right.
burnout rate is at least half the docs, and the old joke there is half the docs are burnt out, and the other half just lie about it, because the pressures of the job are just so enormous. So where do I think it's coming from? Well, first of all, the definition of burnout is by Christina Maslach, who's one of the godmothers of burnout. And the definition is based upon people feeling emotionally exhausted, cynical, and feeling that whatever they do is not meaningful. It's their personal accomplishment is low. So if you have any one of those three, then by definition you have burnout. So when they say half the docs are burnt out, when they answer surveys, they answer positive to one of those three areas. The other thing about burnout that I keep in mind is that trying to solve the same problems over and over, that could burn people out also.
Mm-hmm.
So where does it come from? Well, if you look at the studies, it comes from docs doing a lot of things that docs never really signed up for. So all the bureaucracy that needs to go
Right.
into it, all
Yeah.
the regulations, all the documentation, all these things that all we really want to do is take care of people, interact with people, and make people better. That's what we want to do. What we don't want to do is all this other stuff. And what we don't want is to be intruded upon by outside forces, which have really integrated themselves into medical practice. So where does it come from? It comes from there. And it's really the burnout also might be associated with something called moral injury. And that is to say, when you have somebody doing something that they know is not right, then it creates this additional pressure on them. So, as an example,
Mm-hmm.
you know, when I was back in practice, and I'm still very clinical. I still do all the, and I'm an endocrinologist, so I do all the endocrine consultations at our hospital, and I oversee our diabetes program. So I'm very clinical. But when you have people who are in private practice being told that they have to see a certain amount of patients in a certain amount of time, that goes against their grain. It's not how we were trained. And
Mm-hmm.
but we're asked to do these things, and we're kind of pushed to do these things because many of us are employed or based upon reimbursements. We feel like we
Right.
have to see a certain number of patients to not only to pay our expenses, but also to take home a living that we think is commensurate with the amount of responsibility that we are put upon us. So
Mm-hmm.
moral injury is if you ask doctors when they signed up to go to medical school and become a doctor, and they weren't doing it because they could see a patient every 10 minutes. They were doing it because they wanted to take care of people. And now all of a sudden they're asked to do it, see more people, and do it quicker. One of the reasons why I left my private practice was I was employed at that particular time because I thought that was one of the ways I could survive all the outside influences on my practice. But
Mm-hmm.
when I was leaving private, I was actually giving an ultimatum. I was working so hard. I mean, 80 hours a week would be part-time for me. It was all day, every day, nonstop. And so and I was on the list of best doctors in America every year annually, and I had a waiting list 6 months long for people to get in. But the people who own the practice said, you got to see more patients. And I said, I cannot physically see more patients. They go, well, we're going to cut your pay. And I go, first of all, as an endocrinologist, we're one of the lowest paid specialties to begin with because we don't have any procedures. And I said, well, that would be wrong to cut. Why would you cut my pay? I'm playing at the highest level possible. They go, but you got to see more. I can't see more patients. So I was left with an ultimatum. Do I continue to practice the way I want to practice, but be penalized financially, or do I want to say there's got to be a better way? and there has to be a better way than just, doing that. So I was faced with that moral injury, and I decided that it was not sustainable, and for that reason I left, which left a real paucity, unfortunately, or dearth of endocrinologists, which is the lowest representative specialties to begin with. So it
Um,
comes back to this moral injury,
so,
stuff that they don't think is the right thing to do, and
mhm.
you do it or you do what I did, and that is say, you know what, I'm just not going to do it. I'm not going
Yeah.
to sacrifice myself and my patient's care.
Yeah, it doesn't seem like a sustainable path for anybody. So if I said to you, and this is kind of off of the beaten path, Mickey, from what we talked about even previously offline. Um, so pressurized question for you. And if you would need time to really kind of process it and think it through, I understand. So it's not that heavy. But if someone gave you the proverbial magic wand and said, okay, what would you do? What's one thing you would do tomorrow to help improve what we've just been talking about? What would it be?
Well, I wrote about this in the book, which, by the
Okay.
way, is still available on Amazon.com.
Of course, and I'm glad, and everyone should go out and buy it. Because, well, yeah, I got to be careful here because
It's a
I have sat at the feet of Mickey Liebowitz many times, so I learned so much. But yes, and by the way, everyone in the audience, we will have a link in the show notes. But go ahead.
I was going to say the book was a bestseller in my mother's house. She liked, she liked it. But what I wrote about in the book was, I think if I had a superpower
Hmm.
to fix medicine,
Yeah.
I would get rid of greed. I think there's plenty of money in the system, but how it's distributed is unequal. And there are a
And
lot of
by that, let me interrupt you, Mickey, because you just hit something really powerful there. So if you could eliminate greed, and I know those out there, you might be thinking, well, you can't do that because that's this, that, and the other, but it is a symptom of the problem, right? The greed factor.
a symptom of the problem. Well, tell me more how you're thinking about that.
Well, I guess what I'm saying is that when we think about greed,
Yeah.
it's kind of mystical. It is, I mean, some would say maybe it's an emotion, but I guess what I'm saying is it's not detectable. It's not really measurable, right? No one can say, well, because you live in this neighborhood and drive this kind of car, you're greedy. You can't do that, right? Just
Yeah.
like I could be in poverty and be greedy. I guess what I'm thinking about, Mickey, is that when I look at the system and all that's going on and what's driving it, I mean, you used the example with you about, well, you need to see more patients. Well, why do you need to see more patients? It can't be because there's people out there dying on the street from diabetes and we need to get them seen by a doctor. So what's the motivation? And part of me thinks greed is the motivation.
Yeah. So I think that there's an unequal distribution of money, and I think it impacts. So there are people who have, and there are people who have not,
Right.
and it shows up in healthcare disparities, which have been well written about. So
Mm-hmm.
certain minority groups are their care is their time to diagnosis. Women of minorities, pregnancy issues, birth issues. So it's all well written. And what I think, if you gave me this superpower, which
Yeah.
I would very much appreciate, by the way, is what I wrote about in the book, and I still stand by it. Is if everybody really wanted to, if what really people wanted was to take great care of patients or give them the greatest opportunity to care for themselves, then I think what you have to do is put all the peas in a pod. And what do I mean specifically? All the players, P, start with
Mm-hmm.
the letter P, the physicians, the patients, the pharmaceutical, the plaintiffs, the politicians, so on and so forth. Put them all in a room, put all the peas in a pod, and don't let them out until we get what's best for most. That's what I like to see. So if I had a superpower, that's what I would do. I would say, what is best for most?
Yeah.
And everybody gets a little bit of a piece of the pie, but but some people don't get more of a piece of the pie than others.
Well, and Mickey, and this is not just a healthcare realm thing. And I've used this example in previous episodes. This was an article I read in the Wall Street Journal about Harvard MBAs who've gone on to run major corporations, and looking at the dynamic of what are the studies, what are the subjects inside of these Harvard MBA programs. And it was very clear from the article that shareholder value, stock price, quarterly earnings, expense control, those kind of things were the paramount things focused on. And someone might argue, well, of course, Eric, if you're going to run a business, you've got to focus on those things. But very, very little attention to character formation and development, integrity. So I think we're reaping the whirlwind, if you will, now. So are we really surprised if a CEO or someone who's in a position of authority does not know how to handle power, does not know how to resist greed, because what you just described is a mindset. You got to have a mindset that says, well, of course, it is for the most. It's not going to be okay for me to continue to do this while other people are doing that. And I'm not saying that we want to control of what a doctor can make or what a Wall Street banker can make. That's not my argument. My argument is management of it, because at some point, I think when you develop character and integrity and you understand about power and greed and the impact of those things, you can see things through a lens that says, wow, I'm going to start learning more about contentment. I'm going to start learning more about, it's more important about other people than myself. And I think that's lacking in the educational realm, let alone, in the other places one might learn it. But I'm glad you touched on this, because I do believe it's something that it's almost like the 800-pound gorilla in the corner of the room. All right. So as always, we get so compressed with time. I want to move to another thing with you. So it's easy for patients to say, "Oh, my God."
Before we move on, though, Eric, I think it's worth saying that or mentioning that the United States, which is maybe arguably the richest, wealthiest country in the world, how come our healthcare is the 37th listed best healthcare system in the world? Why is that? Is that okay? I mean, people have to come to the grips with, is healthcare a right, or is it, if you have money, it's good, and as a physician, everybody who came to my office was an MVP, a most valuable player, and I took care of ambassadors and people in high level positions, but I also took care of people who were impoverished. And I got to tell you, from my standpoint, they got the same care.
Yeah.
Right? Because they're people.
Yeah.
They're people. And they have a story to tell. They have the same fears and challenges, whether you have a lot of resources or don't, but everybody's people. And I think that it's talk about mindset. And if you ask me again, and I'm realistic also, and I know that we're not going to get all the peas in the pie. By the way, one of the other peas I left out were the payers. So I know we're not going to get all the peas in the pie. But if you ask me if I had a superpower, what the problem is, and what I think that the solution is that everybody gets a piece, because in the end, we think that all people deserve to have, or have the right to have, good health care. And we're going to foster that. and we're going to distribute the money accordingly. Here, let me just give you one more example as I ramble on here, and
Yeah,
that
no
is, why are there so few primary care providers or physicians or clinicians? Why is that? And the answer is because they get paid much less than your plastic surgeon or your ophthalmologist. And but we need primary care providers or physicians or clinicians. People don't like when physicians don't like to be called providers, and I don't like it either, but that's some of the terminology people use. But the point is that we need more people on the front lines, and it could be fixed tomorrow, Eric. It could be fixed tomorrow. How do you fix it? Pay them accordingly. Pay them accordingly, and you'll have more people in that position. And in so doing, you'll have more people who will have primary care, who will get preventive medicine, who won't just show up in the emergency room when they're in extremis of some type, because a lot of these issues have been settled beforehand. And then they
yeah,
and
because
then and then maybe people could have physicians could have and clinicians could have the time to really connect with people, and they don't feel so forced, and relationships are built, and trust is established, and people will do what their physicians are coaching them to do.
Yeah, and the thing that you mentioned there with the primary care, and I think it's important to note. I mean, most physicians did not get free education, so you have to assume they're carrying a tremendous level of debt.
Yep.
They're working, which I consider to be unsustainable hours, in addition to all the things that you just mentioned. So if a primary care physician is faced with all of that and then coming to grips with the fact that they're not going to get paid, commensurative, right? Yeah, that's a problem. And I think, again, you used the term greed and that impact. And I think if we were honest enough, if we had the level of character to address it, to be able to say, you know what, no, this needs to be eliminated from the system. And quite frankly, it got into the system because somebody was with a lobbyist firm. I mean, fill in the blank, legislation was passed, or it was agreed to. And wow, we could talk a lot about that, and I'll spare our audience me riffing even further. So let me pivot and transition to. I am of the firm belief, I mentioned earlier, that I am the manager. I am the one that's responsible for my health, right? I'm responsible to make sure that I am caring for my physical, spiritual, mental, and emotional health every day, and I should be intentional about that. So where I'm going with this, Mickey, is that since there is a certain level of responsibility, I'm not saying everybody's got to do it at my level or my approach. Everybody can be different. But when someone goes in to see a physician, or even interacting with a nurse or a nurse practitioner, whatever it may be, what are some things you might recommend that the patient remember as they're going in for that visit?
Yeah, well, if you wanted to make the time more efficient, so that if you had a finite period of time, a 10-minute office visit, 15-minute, I did 20-minute office visits. And the reason why I did 20-minute office visits, because the case of the patient, the people I took care of had extensive medical conditions. They had diabetes, high blood pressure, high cholesterol problems, heart disease, strokes, thyroid problems, and they were on a long list of medications. And sometimes it would just take 5 or 10 minutes just to go through their medication list and to make sure that they were taking the medications accordingly, appropriately. So my point is that if you can come to your office visit and help your physician, clinician be more efficient with their time, so that you come in with your medication list, so we all know what you're taking, we're on the same page, there's no mistakes about that we know what you're taking and how often you're taking it, because just because it's on the list doesn't mean you're taking it. Be respectful. Hey, by the way, I miss this dose 2 times a week. I just want to let you know, just in case my tests come back off. So I would also be prepared with a list of questions that you have on your mind. So write them down. These are the things that are most concerning to me.
Mm.
And so I guess my point is, make your time with your physician, clinician, much more efficient by being prepared with a medication list, a list of questions, and also some additional, if you have the wherewithal. I mean, health literacy is it's something you have to train for and have to be familiar with the terms. But if you can read up on some of your medical conditions, and there's a lot written for people, patients, if you will, about many of the common maladies that affect people. I think those are all things to make the time much more efficient.
Gotcha. That's great. Thank you for that.
Yeah.
So, Mickey, what are you excited about these days? What's going on in your world that you'd like our audience to know about, whether they can be involved or whether they just want to, keep up with what you're doing?
Well, I appreciate the opportunity. I am, one of my main missions as I age here is to integrate emotional intelligence into healthcare, where I think there's a significant need and a significant void. And so that's been my journey over the last 5 years, as I've become certified through 6 seconds as an emotional intelligence assessor, a practitioner, a facilitator in the vital signs, and more recently as an International Coaching Federation certified coach. And so I've been trying to integrate it. I've given multiple workshops to physicians and nurse practitioners, PAs, office staff, spouses of and significant others of healthcare clinicians, nurses. And the reason why I like to talk to the spouses also, or significant others, friends and family, is because so that they have a greater understanding about what their loved one is going through. So especially when it comes to burnout. So I do a lot of workshops. I do presentations. I do a lot of coaching for physicians who are thought to be quote unquote disruptive in, let's say, the operating room, or have challenges with professionalism, or issues with interpersonal relationships. And if they were in a medical group, that there would be concerns that that physician isn't playing well, if you will, with the other. That's not a good phrase. If they're not having good interactions with their colleagues. I do a lot of coachings on physician assistant students, again, as the medical director of the program. And the thing that excites me as much as all that, in addition to all that, is I'm currently involved in a longitudinal research project looking at the impact of emotional intelligence on physician assistant students. And what we've showed is the value of EQ in students. That is to say, students who are optimistic, who have good well-being, which is balance of life and physical and emotional health, and maybe most importantly, good relationships with friends and family and people in their network, that those students do better great with their grades, with their certifying examinations, with their preceptor evaluations. And to us, that is very exciting. And we just finished another part of our study looking at burnout and emotional intelligence. And what we've showed is that students, again, who are optimistic, who have relationships, well-being, and more, are less likely to burn out. And that really makes me even more motivated to try to integrate EQ into healthcare, because it's all stuff that is learnable and competencies. And if you want to, get additional enjoyment and reduce your risk of burnout, have additional success, 2 letters, EQ.
Wow, that's awesome. Well, for the audience, we'll have Mickey's contact information if you'd like to get in touch with him about any of those things, any of his endeavors, as well as I wish, man, I had, you talk about a superpower. I wish I had a superpower to control time, because I got other stuff I want to ask you about.
Let's do it again.
I was going to say, so as we've done before.
Talk to you, it's a good time.
So we are definitely going to have you back, because there are some other things that I want to touch on. But I think this episode is going to be great for those that whether they're in the healthcare system as a quote provider or whether they're a patient. I just think it'll give them some hope and direction too. So Mickey, I can't thank you enough for taking out the time to be with us, and we will definitely invite you back. And for our audience, we thank you for tuning in. Until next time.